Hi everyone, so I did chapter 11 and I focused on the idea of acting as a unit. And they start off by discussing how the Cleveland Clinic was founded to explain acting as a unit. And this was by three doctors who worked shoulder to shoulder during World War I. And they really saw the benefits of working together as a group versus individually. And they took this idea of working as a unit and represented that into their values at the Cleveland Clinic. They integrated this into their own work, into their medical practice, as well as their research, and into every area of the Cleveland Clinic. Now, when it comes to working with the patient, they really wanted to work as a unit to give them relationship-centered care by collaborating with them, and they take into account the patient's values, preferences, and goals. And this is essential to providing high quality and safe care. And this also leads to clinicians being more professional and really giving their patients their best practice. So I connected this back to Trouble Talking, the tale called The Robin Hood, which is about Alice, who has Frederick's ataxia, and her mother brought her to the clinic hoping to improve her speech. And one thing that the clinicians notice is that Alice has always wanted to try archery. So without the mother and Alice's notice, they contacted the local Rod and Gun Club, and they surprised Alice by customizing an archery shoot for her. And Alice ended up being really good at it, and she split her first arrow. And at the end of this, she said she could finally say that she was good at something. Now, this really focuses on the idea of working as a unit with their clients. And finding something that she really loved really increased Alice's confidence, and this probably increased her motivation during sessions and also greatly increased her rapport with her clinician. And working as a unit really gave Alice the chance to do something that she really enjoyed. I also connected it back to performance of medicine, and this was to chapter 4, What the Patient Wants, specifically respect. And in this chapter, they explain different ways that doctors show disrespect to their patients that they may not notice. And I think that all of these examples really emphasize why working with the patient is the best way to go. Now, a lot of the complaints that the patients were making to the doctors is that the doctors were dismissive, the patients didn't like how they were being addressed, the patients were confused, and they processed more complaints. And they really emphasized that working with the patient and acting as a unit, the patients will feel cared for and empowered, and this will involve them in their medical decisions, and it will cause less confusion, and patients will report less complaints as well. And I connected this back to a Kevin MD blog post that is called Collaboration Rather Competition Improves Patient Care. And this discusses the idea of hospitalists, who are clinicians that primarily focus on the care of hospitalized patients, partnering with community physicians to prevent burnout. So the blog post discusses OBGYNs who work at private practices who have to be on call at all times because their patients can go into labor at any time of the day, and how hospitalists should really collaborate with OBGYNs to enhance patient care and also prevent burnout. And they can do this through communication, good documentation, and availability of medical records to the other provider. And I thought back to us being SLPs and how we also have to collaborate with other professionals, and that we want to be reminded that good communication, good documentation, and having those documents available to other physicians can really give them less stress, as well as on our part less stress for us, but less stress, more collaboration and more communication between the different professionals. So my discussion question for you guys is, what is a way that you can work as a unit now with others in our cohort? And one of the things that I thought of is that we have a group chat and we kind of ask each other questions as we go. And I think that's a great way for us to act as a unit. And then another example I thought of was that we do have a Google Doc together, which has all of our EBP. So I thought that's a great way for us to work as a unit, and you can see who added things and ask them questions. And then another one of my discussion questions is, who will you be working with as a unit at your externship? So I knew that we'll be entering our externship soon. So who will you be working with as a unit there? Personally, I'll be at a private practice, so I'll be working with the patients as well as my supervisors and other SLPs, as well as other professionals that the client may be working with. And for an activity, I wanted you guys to think about a time where you thought you didn't need help, but found out that working together and with others would have or did greatly improve your performance. And then one quote that really resonated with me about acting as a unit is, if you want to go fast, go alone. And if you want to go far, go together. So this really emphasizes the idea of being in a group, you will get farther because you'll have different ideas, collaborations, and you guys can really bounce your ideas off of each other. Going alone, some people do better and faster, but having that group of people can really be beneficial. So thank you guys for listening to my presentation.